Ladies and gentlemen, millions of Americans are losing access to maternity care. And it's due to a low birth rate going on in America. So, all of these maternity wards and hospitals are closing down their maternity wards in America. And I've been talking about that for a while now. Well, these things are actually getting worse. Access to maternity care is decreasing in parts of the US that need it the most, affecting nearly 7 million women of childbearing age and some 500,000 babies. That's according to a report released Tuesday by the March of Dimes, a nonprofit focused on maternity and infant health. It found that 36% of counties nationwide, largely in the Midwest and South, constitute maternity care deserts, meaning they have no type of hospital or birthing centers. Wow. It paints a slightly grimmer picture than the organization last such report, which was released in 2020. 5% of counties had the worst designation this time around. So there is a 2% increase in counties classified as maternity care deserts, accounting for some 15,933 women living in more than 1,000 counties. The March of Dimes said these changes are driven primarily by the loss of, in some cases, it is the healthcare provider and hospital services within counties as a result of financial and logistical challenges, including they're saying the pandemic had a terrible impact as well. And it mourns the result of the disproportionately mourning rural communities and people. You know what they're going to say. We know what the people of nearly four Native American babies and one in six Black babies were born in areas with limited or no access to maternity care services. Mothers and babies in maternal care deserts face higher risk of poor health outcomes, including death. Roughly 900 women died of pregnancy related causes in the United States in 2020, the report says, adding that nearly two-thirds of such deaths were preventable. The data for the study it raises predate the Supreme Court decision to overturn Roe v. Wade. The March of Dimes senior vice president, uh, Dr. Henderson, and the interim chief medical and health officer. She says that there isn't enough data yet to show the impact of Dobbs, but acknowledges that there is a known relationship between abortion restrictions and access to maternity care. Henderson tells NPR in a phone interview that the report highlights the scope of a worsening problem in the US and that specific policy changes could help. Many people don't know that we are in a maternal and infant health crisis in our country. Our country is currently the least safe to give birth and to be born in an industrialized country. Wow. I mean, I have never heard any doctor put it that way. And part of that problem is not having access to high quality maternity care, she says. We have failed moms and babies too long in our country, and we need to act now to improve the crisis. Rural areas are hit the hardest. So healthcare has always been a problem in rural areas. It's because their hospitals don't pay good money, not even to the doctors and nurses that work there. And they always tend to be very shorthanded, where they have to send patients to nearby cities because of staffing issues. And I have done videos on that before. So, ladies and gentlemen, they said only 70, I'm sorry, not 70, only 7% of providers serve rural areas. Yeah, because they don't pay well. 2 and 3 maternity care deserts are in rural counties, the report says. Doctors choose to practice often where they want to live, and the majority of the providers are in urban areas. She explains, adding that fewer providers are now available in certain areas, largely because hospitals have closed maternity wards primarily for financial reasons. Some areas did see an improvement in access of maternity care during this period. For example, hospitals expanding their maternity services actually increase access to care in 8 counties compared to 37 counties that experienced the opposite. Florida had the most women impacted by improvements to maternity care access, while Ohio had the most impacted overall reductions in access to care. According to data in the report, nationwide, more than 2.8 million women and nearly 160,000 babies were impacted by reduced access to maternity care. The report underscores the need to improve access to maternity care and high quality care. For example, Henderson says people with high risk pregnancy need access to high risk care. It's one issue to have maternity care deserts and not have anyone to provide care, she says. It's a whole other issue having someone that can't provide the highest level of care that is needed. So, what to know if you are in a maternity care desert? Henderson said other providers can help supplement and improve access to maternity care, including those that serve the federal qualified health center and doctors who practice family medicine. They can be a great source of help to people who can't see any type of maternity care, especially when it comes to prenatal and postpartum care. She explains midwives are also sources of support that have been associated with improved maternal and infant health outcomes. We also know that improving the social and economic conditions and quality of healthcare at all stages of a woman's life will help mitigate some of the issues of access to maternity care because of how healthy a woman is before pregnancy impacts how well she does and what complications she may have and the health of the baby from the pregnancy, Henderson said. So, they're trying to look at other things like telehealth, where you are seeing a doctor via your cell phone, because they're going to have to come up with ways. I mean, what's going to happen to these women if they're nowhere near a facility that can help them get through their pregnancy? So, that is a problem. And I had no idea until this moment. I mean, I knew about the rural areas. I've been knew about that, but it seems to be spreading everywhere across America. So, y'all, please tell me what you think about this story. It's just another dilemma America is in. Looks like judgment to me, y'all. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.